before Mayo Clinic. Basically just said.
19 years old,
Mm-hmm.
playing football,
Mm-hmm.
285,
295.
295 pounds. What happened to?
Just basically lost 120 pounds in one summer
Because
because of colitis.
bloody diarrhea,
Mm-hmm.
couldn't eat.
Mm-hmm.
Give me some.
You
Give
got
me
me.
some words. People don't know what you went through. Only you do.
Just put me on the spot.
That's right. You're just
Um.
talking to me.
Yeah. No.
So you couldn't eat. 15 bloody bowel movements. I mean, tell me exactly how bad it was.
Basically 15 times a day. Couldn't stay in class. Couldn't concentrate on anything. Had no muscle mass. Couldn't do any of my favorite sports. Nothing.
And you get down to be 185 pounds?
163.
160 pounds. So you lost 130 pounds.
Mm-hmm.
Did you see doctors here before you went to Mayo Clinic?
Yep. Seen 3 of them.
And what did they tell you?
All the same answers, that they could try to fix it, either that or be on different medication or just remove it totally.
Okay, so then you went to Mayo Clinic at 19 and a half, whatever age you were?
18.
At 18. So this all started when you were 17.
Mm-hmm.
It's been 4 years now.
Yep.
You got to Mayo Clinic, and what did they tell you?
Same thing. Just remove it, either that or I'm going to be in a pine box by the time I'm 19, 20.
And they wanted to take out how much of your colon?
All of it.
There's 3 terms we use: ulcerative colitis, Crohn's, and the other term I think is called pancolitis, which means they really have to take out most everything. Were they going to take it out and give you a bag, or they're going to try to pull it together?
They're just going to give me a bag.
Okay. And then within a few months, you got through Roxy, you got to see me. Is that what happened?
Yep.
Okay. And we went on a program where I was using bodybuilding or anabolic hormones. And that was, I think, in like September
I think so.
of 2000, 2 years ago. 15?
Yep.
Okay. And you seemed to recover pretty quickly from what I remember.
Yep.
And I'm trying to get you to tell the story, not me, because it looks better. You got up to about, what, 225 when you had the appendicitis in
Yep.
January of 2016?
Mm-hmm.
And tell me, when you got to the hospital with the acute pain in the right lower quadrant, what did the doctors tell you?
They told me it healed up a little better, but it still wasn't good enough to try to save everything.
Okay, but when they went in to do the surgery,
It looked completely healed from the outside.
and they just took out the appendix.
Yep.
Okay, and then we had a little miscommunication, and someone stopped their medication, and you came back to see me September, I believe, of 2016,
16.
and you were back to square one.
I think 190.
190, 15 bloody bowel movements,
Yeah, just about.
couldn't eat, felt like shit.
Mm-hmm.
You're supposed to say this. I'm not doing the interview, you are.
No.
And you wondered if we could get going. And I threw on everything I had, added a second set of different kind of anabolic steroids, and we actually pushed the high dose of prednisone double what anybody else would do. And we got a little better, went to University of Michigan. I got you into the University of Michigan doctor, and he said,
That if something doesn't change, that probably be in a pine box. But,
he offered you Remicade.
yeah,
At that point, you said no.
yeah. But he said I didn't look like a patient that would be needing this treatment, so that's a plus.
Okay, and then you end up going back to the old previous GI guy
Mm-hmm.
after a couple more months of us working on this, and he did a scope in your colon.
Yeah, and only said 2 parts were bad that he worried about, and not the rest was all inflamed like it was in the first place.
Okay, so there's still you had a couple holes he was worried about.
Mm-hmm.
And then he offered Remicade and stopping my drugs, and I said, to you, it's either add something and see if we get a break, because my drugs had reached limit. And you tried how many doses of Remicade? 2?
1.
Just 1. And then you got sick. How'd you get sick on the Remicade?
All joints locked up, muscles locked up, all the side effects that it had, I had.
But meanwhile, in September, your blood count had dropped down to 8. And we were giving you IV iron. Got you up to 8.9.
Mm-hmm.
We had 1 at 10. Then you were down. Then you, before or after the Remicade, you got to 13.6.
Mm-hmm.
I don't know which one worked. But you're off the Remicade now because you were having so many problems. And what's your weight today?
It should be 227.
Which is about where you've been when you've been stable.
Mm-hmm.
Where do we stand with the bowels?
Probably six times a day.
I'm going to recommend if you do take smaller doses of prednisone, maybe we can get that down to 3. Are they bloody too?
Mm-hmm.
They're just 6 bomb wounds a day.
Mm-hmm.
Can you eat things like oatmeal and everything possible, or are there certain foods bother you?
Certain foods still.
Okay, what do you think of something bulking that you can take that's not going to hurt you? Oatmeal is tough.
Other than meat.
So you're a meat? Okay.
Meat's the only thing that is good and settle with me.
Okay. So I'm going to ask you to try to do even 25 of prednisone, just to give another little anti-inflammatory component here, to stabilize and try to reduce the bowel movements in half. And what dose of medicine am I giving you? Do you remember?
I'm not sure.
But you're getting a shot every 9 days.
Mm-hmm.
Testosterone, nandrolone, tenazolol. Do I have you on the oral anavar or oxandrin tablets?
No.
All right. So we'll get you some of those. So it's just a standard shot I gave you back in the beginning.
Yeah.
And we're alive and we're not in a pine box and you're gaining weight and you feel like we're getting you back.
Yep. Feeling good.
Good. Healthy enough to chase after some of the women I gave you pictures of, or not quite yet?
Oh yeah.
Okay. That's the most important. That's the most important part. All right, guy. I'm more than pleased, but we got to get up over one more little thing. So I have another anabolic steroid I'm going to get for you, but I want you to try a little bit of prednisone just to see if we can quiet this down. Here I know we've outdone U of M.